My name is Dr. Louis Machogu, President of the Pharmaceutical Society of Kenya, where I help shape pharmaceutical policy, healthcare policy that's meant to, help raise the profile of our profession of pharmacy, but also just put us at the center of the patient, because that's really where we belong. Whenever the patient or whenever the country thinks healthcare, the first thing they should think is pharmacy. And those are some of the change things that are happening in the country. We've looked at some of those. So I'm really excited to be going through with you this presentation today. I'm also a pharmacist by training, and I also have a place I work in, a company called MedKit Network, where we do capacity strengthening. We help young or even just any colleague who maybe is retiring or young and wants to venture into the pharmacy field. We help them with market feasibility and site selection. We have a template for that. We have startup tools like what do you need to start and things like that, right from the financials to cash flow plans for for your first 12 months, and how to make adjustments and things like that, because you plan, man plans, but it's God who makes plans work. And also the pharmacies that have been in existence, we help them with some efficiency tools. We do all this because we've been running pharmacies before. We used to run Haltons, and we've gone our ups and downs, and we all take that and we condense it for you to help you run your pharmacy. We also do supply and logistics, and because of for the pharmacies that buy from us, we're able to help them with the scoring data that they can get, much needed capital that they, to run their operations. We also do, we call ourselves a network, so it's just coming together and, like just from the spirit of Nyumba Kumi, can 10 of us come together and do something in our locality. Yeah, so that's our contact and our web address. All right, so has been a 4-part series. We started by looking at you. Yeah, are you aware about the change? Yeah, and how do you respond to change? Are you aware there are 4 different ways you can respond to change, and even part of your team? Some of us respond passively; they were spectators. Some of us are victims. Some of us are saboteurs. They just sabotage everything. They did not understand. They felt insecure. They just felt disrespected. They can sabotage. Yeah, but some of us are also ambassadors. There are those of us who are early adopters who will say, oh, there's change, I want change. But there are those of us who say, okay, let's wait, see first what happens, and we'll on board. Yeah, so we have different ways in which we respond to change. And so the first session was on getting an awareness of that. Second session, which was the last week, we tried to understand the changing landscape, both external and internal. Yeah, and what are the drivers? Who are the stakeholders? Yeah, we looked specifically. If those of you who remember, we looked at the SHIF, the Social Health Insurance, Social Health Authority, and one authority, 3 bills. Yeah, 3 acts of parliament. Yeah, so how does that affect you? That law, what does it affect your practice? Navigating change is what we're talking about today. We are gonna be looking at a template. Yeah, basically we just look at a template that can help you navigate change. Today I'll use a specific case example that you've from when you started practicing up to today, you must have gotten into such a situation. And with this template, you can be able to actually initiate change and midwife change through a season without really much of a struggle. Yeah, because going through a season without a template, what happens is things are happening if you don't know what's happening and things like that. Then lastly, next week we'll talk about sustaining change. Yeah? Because yes, it's one thing to make a change, but then how do you keep that cycle? Because then that's how growth happens. Growth is sustained change. Yeah. So basically, I've been doing a recap, but just to remind you, we got together because we are saying our sector in pharmacy in the country needs to change. If you look on the left there, we are saying we want to move from a pyramid to a fish. Yeah. A pyramid means we are all here at the bottom of the pyramid. There's chaotic, our sector, we don't know who's doing what. You have entrepreneurs here running our sector. We have patients isolated and dying because of really manageable issues of medication-related problems, errors, things like that. high costs. If you don't manage diabetes well with the medicines that's available, readily available and affordable, from the imported ones to the ones that are locally manufactured here at Cosmos, you end up having a really high cost of healthcare. Yeah, there's poor accountability. If everyone does everything, who's responsible? Who are they accountable? To there's poor value. There's a lot we are leaving on the table as a profession. Yeah, a lot of unemployment, a lot of underemployment, unfulfilled careers. We have colleagues who enter the sector as farm techs. They're wondering, what's the point of me upgrading to a pharmacist? Yeah, because we're all doing the same thing. Yeah, there are pharmacists like myself with a BFARM who are wondering, why should I upgrade to a specialist? Yeah, pharmacist. But you see, on the other side, the patient is waiting for us to get our act in order so that we can add value to them. Yeah, the other one there is this lack of innovation. Yeah, because there's no incentive to upgrade and practice to the highest level of your level. Then there is no need for me to innovate. Everyone just doing, oh, what is Nani doing? Let's copy. Yeah, and there's nothing wrong with copying, but then it becomes that we lower our profession. So we are all here playing at the base of the pyramid. On the other side, we are saying we need to move to a place where we can see the continuum of our profession. We can see our house and we can see who is in our house. The profession of pharmacy has in-pharmacy training. So you have in the diploma level, in the degree level, in the master's level. These are our people in training. We have interns. They've come into the sector. This is where they are. We have farm techs. Here, this is where they are. We have some upgrading farm techs and also those who are coming from in training, entering into pharmacists. Yeah, these are our numbers. And again, we go to specialists. Yeah, those of you who saw the interviews for the CS of health, there was a question that the Speaker of the National Assembly asked: what is the patient to provider ratio? Yeah, and by doing this, we'll be making sure that our sector is really secure. We want our numbers to increase. We are like teachers in this sector. Yeah, so the profession of pharmacy can really be raised. We can get to maturity level 3. What's the outcome of that? Drive innovation and R&D, our career development, inter-cadre collaboration. My vision is one day, and this vision is supported by many of you, we're having farm techs referring to pharmacists, referring to specialist pharmacists. We all one house, and patients actually sit there and say, wow, where has this profession been? Yeah, we are moving towards value-based care, increase manufacturing of our HPTs, because we are all specializing, we are all focusing on certain areas and driving innovation, yeah, and then attracting investment to come in. What are the interventions required? Remember the first session I took you through the good pharmacy practice guidelines. The link was there. I'll share again. Please go look at that. Jisome mwenyewe, I highlighted for you specific areas that you need to look at. We looked at the scheduling of the HPTs, that's with the Pharmacy and Poisons Board, together the MOH, having engaged stakeholders, what are the schedules that are going to be available for the nation. We have the costed pharmacy benefit package. This is very key. This is what we discussed last week. We said one authority and we said 3 funds. The first fund is primary care fund. The next one is the SHIF fund, social health insurance fund. The next one is the emergency and chronic care fund. These funds are coming in place and they're only going to reimburse for services. So you there in your pharmacy selling medicines, looking to be reimbursed for medicine, yeah? And the rest of the country, 70% of the country has moved to these 3 funds. Where are you? And we also saw that they are serving different levels from the primary care. So we have the farm techs at the level 2, 3, 4, 5, 6. We have 4, we have pharmacists, 5, 6, we have specialist pharmacists. And of course, inside there, all of us are inside there. But we have all those specializations and then services being offered there. There's a list of services, both by all these 3 of them. And of course, we also have the National Pharmaceutical Policies being reviewed, looks into training, products, and services. Quality of care bill. I told you that there's a bill like this that is in the pipeline. This will move us to where now, after SHIF comes in place, or SHA, it will start reimbursing based on value-based care. Oh, we see that that group of that cohort of pharmacies. So you have that nyumba kumi of farm techs, pharmacists, specialists working together. They're getting good outcomes on their patients, so they send more patients there. So that value-based care is coming there. So it's a quality of care build, and that's the vision under which it's coming in. Of course, you have KDA, you have practice build, and that's how we get to where we need to go to. So today, as we come towards the end, in the tail end, I want us to narrow down and just look at specific things. Why does change fail? We've been talking about change. We'll be looking at different instances in our sector. Change has been introduced, and why did it fail? Yeah. We'll also look at change management templates. These are tools to help you anchor and drive continuous improvement in pharmacy practice where you're practicing. Yeah. And we'll also explore change management case study. We'll also look at understanding and removing barriers. Yeah. And then we'll do question and answers. Are we ready? Yeah. Are we ready? Just put some thumbs up there so that I can see we are together. I've really been enjoying this crowd. I'm waiting to see thumbs up here. Thank you, guys. That's how you can put in flowers inside there as well. All right. So navigating change. Yeah. Machiavelli said, there's not, so first of all, the word that pops up for me there is success. So to get to success, you have to go through leading, introduction of new order of things. But he goes on and says, it's going to be difficult, yeah, perilous, and uncertain. That's how change is, yeah. So I'd like to ask us a question at this instant. Let's go to the chat. What are some of the common reasons for failure of change? Change was introduced, but all of a sudden we were excited, kidogo, yeah. A new cabinet was, the cabinet was dissolved. Kidogo, you go look again, same people, or even worse, yeah. But I'm not a judge of that, yeah. But give me common reasons under which you see change, failing. Let me go to chat. Fear of the unknown. Thanks, guys. Thanks, Kennedy, Jen. Yeah. No strategy, poor planning. Guys, just implement. And yesterday I was watching what do you call this thing? Olympics with my daughter and my children. So I have 3 children, and all of us were sitting there, and Faith Kipyegon was harassed by that person. We won't name their country. They were harassed. Like, we all in the house got angry. Then the next thing we are hearing, she's been disqualified. We even got murder. Yeah. Then I think we were discussing it this morning and saying, as Kenyans, we've really been getting angry of late. But I think it's just that quest for change. Yeah. I like what I'm seeing there, political goodwill. If there's no political goodwill, you work in. Don't lie to yourself. Even if you're working in a multinational, wherever you are, a hospital, there must be political goodwill. Someone will say, "Oh, we don't fund these things to a pharmacy." Yeah. So there's a way you have to approach it. Yeah. So that and that's what we'll be discussing today. Fear of failure, of course, that one has really plagued me in the past. Lack of preparedness. Just because you've succeeded so much in the past, you have this, weight on your shoulders, and you again fear to, move a step forward. Yeah. So thanks for those, guys. I also did that exercise earlier, and these are some of the reasons that we found. There's no sense of urgency. Change is happening, but sometimes a change has happened, and an opportunity has presented itself. You need to solve that. But there's no sense of urgency. Those of you who watched the 100 meters Olympics men final, Noah Lyles had less than not even 9, because he started late. So he had less than 4 seconds to initiate change in his mind and implement it and go on and win. Yeah. 4 seconds. Some of us will have called for a committee. Yeah. Before we move. Yeah. They will have said, let's first get a guiding coalition. But sometimes there can be a coalition of one person. Yeah. Sometimes because the change is only, if you look at the ingredients for change, they're all domiciled inside you. So sometimes even the number 2, what he's talking about, a guiding coalition, it's not a must that we form committees for everything. Sometimes you can be a outlier and step ahead. So there's no established guiding coalition. Even in yourself, I would just decide within yourself that yes, we need change. This is a situation, we don't like it. The pain of remaining the same is more than the pain of changing. So let us wake up and change. There's lack of a vision. Someone talked about earlier. Yeah. Where are we going? Where we are going? Where am I inside there? How will I benefit? or how will it change myself inside there? There's lack of communication. So you've managed to put everything together, but then it's all in your head, all in your heart, and you're wondering why mnavurugana na watu. Yeah, you are, you know, no one is identifying obstacles, so everyone is fearful of talking back to you as the boss or the team leader or within the team, because they can be fearful of getting fired or something. That's the culture. So no one is removing the obstacles, or obstacles remain, and you know, you don't get to move, and the change initially it was exciting, but then it dies out. Short-term wins, they are not short-term wins. Yeah, you are being driven like slave drivers in that place. We are just moving like this. Yeah, but there is no even to stop and say, guys, where have we reached? Can you see that milestone? Let's celebrate. You know, tununue cake, we celebrate. You know, things like that, so that we can keep the engine running. Yeah, instead of overgearing, lubricate it. You know, celebrating success too soon. Sometimes you can celebrate success too soon. You can wake up and say, oh, we reached the milestone. Give people bonuses. The next thing, people are not connected because wako bado wanakula bonus. Yeah? Walikula bonus, hata sasa wamechoka, hiyo bonus hata ilikuwa kidogo. Yeah? You will get derailed. So you need to figure out how do you create short-term wins, but as well, make sure that you don't celebrate too soon, because then people can think we've reached the end. Because especially if you didn't communicate well, people can think we've reached the end, waamke wakienda zao. But then it's a continuous movement, and there's not interpreting the change into a corporate culture. This is what we'll be discussing next week. Yeah. Let me see. I see something on the financial constraints. Yeah, you're very right. By the way, those are some of the reasons that can actually. So those are some of the obstacles. Financial. There are many obstacles, but financial constraints is one of them. But as you'll see, there are ways of working around that. Yeah. And but if you have any questions, please put them on the Q&A. And also the chat if you so wish. So like I told you, I have a case study. I'll just touch on it, then we'll continue, then we'll come and finish with it towards the end. Yeah. So let me introduce you to this hospital. Yeah. It's in Mararal. I used to work in Mararal in 2006, 7, 8. Yeah. I was the district pharmacist in Mararal. So Mararal is a hospital there. It's called Mararal District Hospital. I think now it's a county referral hospital. Yeah. So there's a Dennis Musau there who's the pharmacist. However, he has to go away for sick leave. Yeah. But then an interim manager is introduced. Let's call her Maureen Kemboi. Yeah. She's a non-pharmacy personnel. She's in the stores, like that. She's been there, working with the pharmacists there. So just to say, wacha ashikilie huko kwa sababu anajua afanya management. Yeah. So she does relief management, and so she's the interim pharmacy manager. Quickly, she starts making changes. Within a week, looks at some changes, starts making them. Particularly, there's a matter called shelving responsibilities. Previously, interns are the ones who are shelving medicines and into dispensing bags, putting them there. Those of you remember who are my age mates, we used to put medicines in medicine bags. Tulikuwa tukiweka, there was amoxil, we used to do paracetamol, cotrimoxazole, we used to do, all sorts of manner of things that could be, because that's what could be, affordable. Yeah. So it never used to come in blister packs. So they said, no more interns. Let the farm techs do that. Yeah. And then they go ahead and says, so they remove the interns. Then the next thing he says, I want the farm tech dispensing uninterrupted on the windows. Yeah. So why? I'll talk about why just now. Yeah. But then in addition, also they want them to be resolved for shelving. Number 5, I want the pharmacists to do medication use reviews. Yani amekuja tu without even consulting anyone. We all know medication use reviews ni nzuri, but hazijakuwa zikifanywa. Yeah. So anasema lazima tuanze kufanya, na tufanye ngapi? 6 per week. Yeah. I want also to reduce the waiting time. Ametoa figure kwa kichwa yake, amesema 25%. Number 7, for the repeat dispensing services, I want us to start signing up patients for repeat dispensing services. This patient is on a chronic medicine, we want to on border like that. And shikasema targets ni easy. Hata ujaangalia kwamba tuko na patients wa chronic care kweli na ni wangapi na tunaweza convert wangapi. So kama tuko na 5 kwa wiki, how can we see or convert 20 of them into repeat customers. Yeah. So the staff were disappointed, the changes are happening without them. Whenever they will try to say something that all kwendeni huko mwende mtafute kazi, look for work elsewhere. Yeah. If you don't want change, this ship is moving. Now, as you look at this case, yeah, there's some things I want you to think about, because we are gonna touch on them later. Yeah. The change, I don't know where you see where, first of all, is these changes good or bad? Let's put on chat there. Huyu boss ni mzuri ama, yani hizi change ameleta ni mzuri ama ni mbaya? And I expect like a normal distribution, kuna watasema mzuri, watasema ni mbaya, majority watakuwa hapa katikati, hakuna katikati ni mzuri ama mbaya. So yeah, they're good. I can tell you why they're good. There's a place there, she says, we want the Farmtech to do this work, and then we don't want the interns. Okay, maybe wanasema we want to manage our costs, because that's a good thing, to manage costs. But you see, you need to talk with people and figure out what are the opportunities we have. But maybe that's the reason behind that. The next thing you see, we need to increase revenue by giving medication use reviews to our patients, so that we can charge for it. See, that's a good thing. Yeah, but no one has communicated. All we just see as in the pharmacy is just new workload. So as we're thinking, these changes are bad. Yeah, because no one has consulted us. We don't even know what is the position of the pharmacy. We didn't even know we are unsustainable and things like that. We're even now starting to say no. Tunataka pharmacist aletwe kwa sababu huyu mtu ajui kazi. Wacha akwende. So shida ya huyu mtu ni ajui kumanage ama ajui pharmacy. Inaweza kuwa both, inaweza kuwa moja. Yeah. So you need to ask yourself those things, because these are the realities in our workplaces. Yeah. And is there a way this change can be good? Yeah. And yeah, is there a way that change sometimes is a catalyst, ni kama yeast, inakujanga tu hivi, nani alienda leave, mkaanza kuona kuna opportunities ama kuna challenges ambazo tukatani ikakuwa opportunities. So that's a case I want you to reflect on. We'll come back to it. Yeah. So because sometimes we struggle with, is change good or bad? We can get stuck. So that's why I want to share with you this change management template. Again, this is a PowerPoint slide. It will be available to you. It will be on the video links will be sent to you. If you subscribe through Daktari Online, it will be sustained there. You can always go back to it. So number one, you need to look at your needs. What are the needs? Why are we changing? Yeah. And I took you through this like time. We look at external, internal changes and things like that. Number two, you need to look at the business case. Now, it's not enough to just go tell if you want to change something at your pharmacy and where you work, or wherever it could be a different sector, and you're telling your boss, I want to increase headcount. But your boss is thinking, this is money, it's cost. How is that going to help me? And my boss is stressing me about we are over expenditure. Yeah. So how is this going to help me? You need to talk whenever you have a thing that you have to put in a business case, so that answering the question of the company. Yeah. The company has a challenge. It needs to a perspective. It needs to be answered as you make your change. Analyzing what are the stakeholders, all those things. How can we work together? Who can I leverage? Things like that. Make an action plan and your implementation. Implementation is the actual one. Then this cycle is a continuous one. Next week we'll talk about how do you sustain change. Yeah. So the first one is needs. So kuna vision. This vision, you need to describe it vividly. The way I vividly described with you guys, in the future, 10 years from now, I want us to be able to take our children to universities abroad from this one pharmacy practice that we have. Yeah. What are our values? We hold excellence. We hold, all those things that we stand for as pharmacists. Yeah. Patient first, all those things. So there needs to be a compelling place. There needs to be values that bring us together, and there needs to be a big, hairy, audacious goal. We are saying we want all. If you remember, we want our sector to look like this, the one on the right. We want to see our continuum of professionals. We want the patient getting value from our sector. This is how we want to see it. So right now, if I tell you that, it sounds like a very, a big dream that can it be happen, but that's really the, you need to talk about vision. And when you're talking about the vision, your stakeholders have to see themselves inside that vision. Yeah, they need to look at the competition externally, what's happening. You need to look at the dissatisfaction. Yeah, are your staff, like if you look at our case just now, why are the staff dissatisfied? Yeah, why are the customers dissatisfied? You talked about we want to reduce the waiting time. Where did you come with the idea that waiting time is a challenge? Are the patients complaining? Yeah, all those kinds of things. Yeah, you need to look at quality, products and systems and processes. Are there bottlenecks in our processes? Yeah, all those things. So you need to look at those needs, or is there a change in the processes that necessitates that we now need to relook and make a change. So that's under needs. And these are some of the questions you ask yourselves that you'll be able to answer any or drive any change wherever you are. And we'll answer them just now with a case study as I take you through this template. The next one is business case. What's the purpose of this change? What's the scope? Because as you look at scope, you're able to even determine what's the cost. Yeah, what are the expected benefits, financial benefits, so that when you're saying there's no budget, but there's something called cash flow, we're able to move this money here. You're saying we can be able, by moving this money here into your department, we're able to quickly reorganize this, and in a year's time, we will have doubled our growth and quadrupled our customer satisfaction. Any CEO will wake up and look. So those are the languages you need to use. Negotiate on the consequences, because this is happening, then it will cost us this much. Yeah, but that cost has the following benefits: short term and long term. Prioritize. Oh, okay. There's gonna be pushback, but then whenever you're driving change, always remember there's going to be pushback. Don't take it personally. Yeah, some of us take it personally. Unadhani kwa sababu vile ulinyoa nywele hiyo asubuhi, ama hiyo blazer ulivaa leo, no, or your tribe or something like that. No. Take the feedback, depersonalize it, even take the feedback, give it to someone else, and ask, what am I not hearing? That is very important. What am I not hearing? Then look at prioritizing, go back with a counter proposal, justification, and make some measurements and address the issues that have been raised. Yeah, some of them could be regulatory. It can't be done. Yeah, do an analysis, look at the affected area. Okay, so if you look at our case here, they want to deal with increasing the patient time, patient satisfaction. Number two, there was a issue around increasing revenue. Because and also managing costs. That's why they said replace interns with farm techs, because already we have farm techs. We're no longer taking interns because interns wanakuja wanataka 50k ya or whatever k ya kukua hapo na hatuoni nini wanafanya. But you remember there's a reason why you do all these things. Yeah, so you're able to go back and then make a counter proposal. So look at the affected area, the people affected, the customer, the employees, the suppliers. Look at the requirements. Is there any new technology, new equipment that's required? So break your things down like this, break your case down like this, and even practice it before you even go share it out. And I can guarantee you will be able to, be able to drive change. And the next thing you're in a meeting, people are always saying, oh, let's defer to this. This is the champion for change. That's a good thing to be known as in an organization, the champion for change. And by the way, there's nothing wrong with even being, you're feeling, anxious or something like that. Yes, you're feeling, but you have a plan. Yeah, that's the important thing. Someone talked about planning. So we're talking about action plan. So the next one, number 4, is action plan. So you need to look at your tasks, schedule, who's responsible. There needs to be a communication strategy. One of the challenges we always forget, especially as pharmacists, I've seen in PSK, and I'm to blame for this as well. We have many new ideas and doing so many things together and things like that, but no one is communicating. You've gone for a meeting, and I like the way the cabinet usually communicates. President has met, cabinet has met. The next thing you see, a cabinet circular. Yeah, communicating. How does this change and impact you? The following was discussed. The following were changes. The following were actions, so that you can also keep people accountable. And also, importantly, so that you, the person listening, you can see Masilayana, people are talking about the issues that are close to you. Yeah, there's nothing as bad as you're seeing things changing, and you don't know when the real issue that is really affecting you is coming. But when things are transparently communicated like that, it means I can even plug in, review and pilot. Yeah. So task, The task should be clear with the goal. What are we trying to do? The dates, responsible people, the strategy, dependencies. If this changes, what happens here? Yeah. What else is affected by this change? Resources. How do we measure success and progress, and how will we report? And what are the issues? Implementation together with making a culture of change in an organization is what we'll talk about next week. But there change communication, allocating responsibility, monitoring reaction, measuring the progress, especially around quality, because that's some of the things we tunanyonga or we reduce whenever you're saying you want to make a change because of budget issues, yeah, and realign as necessary. There is no shame in changing your position. Yes, we started with this plan, but there's no shame in changing, yeah, and assess what success and things like that. So as we look at that template, yeah, that's a template I want you to own and have somewhere whenever you're trying to see change happening or it's happening, being driven out there, and you're seeing, there's somewhere I can help here. I can see you have a challenge with communication, yeah, and I want you, or okay, don't say it like that. So the change has been happening in an organization, and you're seeing people are struggling. You can see the issue is communication. You go to the table and say, I see I have some competencies around communication, and I have the following, suggestion and time that I can able to drive this. Can I be available to do this? Usiende kusema ati, oh, can I be given a salary to do this? No, first go try it out. Then they'll test, and then they'll call you back. Yeah, and then from there, you keep doing, and then you can actually keep growing a negotiation. Negotiating as you do. Because also part of changing your salary is also, initiating change. Yeah. But as change also happens, you're going to see resistance. Yeah. And three things are around resistance. So there are management issues relating to the change itself, and sometimes there are people issues. And as you look at that slide, I have some questions for you that I want you to put on for me on the chat. Yeah? I can see some of those chat conversations. Thank you, guys. Dr. Barbara, I see Esther there. Thank you. So I have some examples of some changes that have been introduced in our sector, but that didn't work well. Yeah. And I want you to pick any of these and put it on the chat. What drove that one? Yeah. Let me go for this one. Introducing PharmD. The pharmacist here can remember a year ago, 2 years ago, the conversation on PharmD was introduced into the country, but it was really fought. Yeah. Can you give me examples of what you think? Don't explain, just say job security, employer, new challenges. Give me examples, yeah, then we can discuss. Yeah. I don't know if you remember that. And also, I can also add it together with scrapping the diploma. Yeah. Because that was a conversation that was being had in the country. So those two, what are some of the things that you saw were driving the resistance from any of these, or even you can add one? I'm waiting for the chats. Let me pick one. PharmD. So when PharmD was introduced, it was introduced like this. This course is very clinical. It's gonna be very nice, specializing, like that. It will allow pharmacists to go abroad, go practice abroad, like that. Yeah, including myself. Yeah, I woke up and I'm wondering what do you mean we need PharmD? Yeah, why do we need PharmD? But then the question was the challenge that was there was around jobs. As I consulted colleagues, these are some of the issues I had. Wait, I'm in the public sector. You're telling me someone is going to do a PharmD out there and come into the sector and say they are more clinical than I am. You see, it threatens someone's job security. So, as a person introducing that change, yeah, you've seen there's a need for this, a PharmD, yeah, but you haven't addressed this issue for this stakeholder. So of course they're gonna shoot it down. Yeah. The other thing was the diploma. So we scrap off diploma. So we just say that like that. But then there is no even to understand what's the vision. Where do you see myself then? The one who has a diploma today, or the person training diploma? Because there are pharmacists who train diplomas. Yeah. what is gonna be my role after? Yeah, that's how I feed my family. So an element of job security there. That's a people issue. You could see an ownership issue. There's no one really owning this. We try to see who is the driver of this. Oh, they label someone like that. Then when you label someone, they even become fearful. They never even come and help us, go through that process of. So there's a fear of. So you can't drive the change because you fear of being intimidated and things like that. Yeah. So there was fear I can see there, fear of the unknown, lack of dialogue within parties. You can see, there's no commitment on demonstrate. There's no demonstrated commitment. You're not telling us, okay, uh, we are going to have stakeholder engagement on the following activity over the following. So it needs to be publicized so that we can then know, we can prepare ourselves to come. And there's nothing bad by saying, initially the people came and they were so defensive, argumentative. It's okay. Let people come and air so that we can pick the issues, and then we can be able to answer the issues and see and align and make a plan around change and say, okay, this is how we transit. This is how or else then if you introduce change just like that, then it will just collapse. There's no clarifying of the changes. There's no trust. Those guys want to finish us. Yeah. Those guys of degrees want to finish us, the guys of diplomas. Those guys of masters want to finish us, the guys of degrees. Those guys of Farm D want to finish us like that. So it becomes like that. Who benefits? No one. The profession, people run away with it. We never get to move. Other professions get services reimbursed by social health authority, but we don't, because we are not organized. We are not, because we never really manage our change transition. And that's what really happened in our sector. Yeah. I would say change has really been tried to be introduced over the past. For example, there was the issue around VetMed. Yeah, VetMed are meant to be returned, in Cap 244, but then that change, of course, maybe it's at ministerial level, but really it needs to be handled conclusively. And I like to say that in confidence that we have actually the PPB and the sector stakeholders are actually working on that to ensure that veterinary medicine is within Pharmacy and Poisons Board or KDA in the new dispensation, and not in another ministry, because then we want ourselves to be housed and strengthened so that we can actually, because the medicine is one. Yeah. And of course you need to be flexible. So that's our management issues. Issues around the change itself. There's, maybe the change, either didn't look at the problem well. Yeah. So it looked at maybe a symptom. It wasn't solving the real problem. Yeah. Values and ideals. You need to understand what are the ideals that bring these people together. So, and when you're making this change, it's moving away from our values. Yeah. As a profession, we're about excellence. We're about scientific data. That's something I've come to learn from pharmacists and the profession of pharmacy. It's we like evidence based. Show us the evidence. Yeah? New challenges crop up, and we are unable to frame that, and support across all levels. So there's no institutional support. Yeah, and those are some of the challenges that resistance and ways to. Of course, the ways to address those is just now, to be flexible, be able to engage and so on. So let's go back to our case study. Yeah? You remember our case study? So someone came in, made some changes, did not call, there was lack of discussion. So this is the evaluation. There was lack of discussion. Yeah. Someone transited out. We were not told what will happen, who's coming, or whoever is coming, what are they going to do? We can see that they're not a pharmacist or a farm tech. What work are they coming to do here? They are not a pharmacy professional. So what are they meant to come and do here? And what is their level of work? Even if they're a manager. Yeah? So there's miscontribution. There wasn't consultation with the pharmacists and farm techs. Arbitrary targets were picked. Yeah, nothing as bad as you're going to start a new month, you have a performance-based contract, and then you hear someone just throwing numbers. Yeah, so you wonder, how will we get to onboard 30 chronic care patients and we only see, we only see 5. Yeah. So, what other activities are we going to do? The threatening behavior, there is ineffective changes, changes are made without participation and confusion on the risk. Yeah. Unrealistic targets, because then you said next month we'll sell this much. And that's how we will pay our salaries and rent, and even the stocks. So what if we buy so much anticipating this sale and then we never sell it? Yeah. So let's look at that particular case, and I know you all have some ideas on what. So maybe let me know if any of these changes then resonate with you. Yeah. So these are some of the recommended changes or change management plan for reducing this. So we picked on waiting time alone. Yeah. So if I was the one or you are the one running this, you'll handle it this way. So you need to define what is the need of the change. Yeah. Look at the aim. The aim is patient satisfaction, reduce backlog of unfilled prescription, and increase the turnover of prescriptions. Yeah. So then the patient will be satisfied. So what are the expected problems? Interruptions, labeling errors, near misses, cause of causing prescription refills. So address those. So anticipate those problems. And those problems, as a manager, you've come in. You can't assume you have the ideas. They come from the people who are on the ground. They're unique. What's the intended outcome? Oh, we want to reduce maybe waiting time to 8 minutes because it was 20 minutes we're seeing. How did you know it was 20 minutes? Because we did a survey. What are the options? Generate solutions for each problem with the participation of all members. So we want to improve the waiting time. We want to ensure that there are no prescription errors. What are the options that we have, and what options can work together? So not all options work in silo, and can they work together, and can they with the same stuff we have before even you introduce new stuff and new equipment? What are the indicators? Patient complaints, that's how we know we are succeeding or failing, when they increase or reduce. Backlog of unfulfilled prescription, the need to increase prescription turnover for competitiveness and income boost, and lack of time for counseling. Those affected by the change, the pharmacists, farm techs, interns, and the patients themselves. So those are the stakeholders we need to meet. Establish standards, define the methods to measure the waiting times. I've mentioned that earlier. Prepare a plan, describe the task, role, responsibilities, have a sense of urgency, put timelines, SMART, specific, measurable, achievable, realistic, and time-bound. Yeah? Urgency, guiding coalition, define the team that's going to lead this. Sindio, yeah? Who are the people who will be driving this? Yeah? The vision. What's the vision? Have a clear vision for the change. Where do you see these people who are working here? There. What will that look like? The patients will be, this is describe that place. Yeah. Communication. Avail the communication, disseminate it, even to the patients on the other side. Disseminate the service charter. Yeah. Empower the employees. Yeah. Encourage them to work as a team. They don't even need to be coming to you as a manager. Encourage new ideas, offer management support and commitment, and that should be, and walk the talk. So not that they come give you feedback and you just put it in the in tray. There is no even actioning. There's, some of you could be running pharmacies, your staff give you ideas, until now they start thinking that, ama naniona tu mimi ni, sumbua. So the ideas are there bubbling. The next thing you see, the person looked for another job. Or they went, like that. Or they went and started a pharmacy next door there. Because then they were unfulfilled here. Because there's no room for new ideas. There's no management support. Yeah. What are the short measure? Define your short-term goals so that you can have ways of measuring the success as you move. Yeah. Avoid early celebration. Like I said, it can be catastrophic. People might think we have achieved, and the next thing you see, people are not going. Yeah. Consolidate. So as you keep moving, look and change your policies and improve on them, and even simplify them. Yeah. So that you can keep it simple. Yeah. Integrate the changes and document that and what you're doing. So we are coming to the end of this presentation today. Today was about equipping you with a toolkit that you can actually use practically. I know we went through a case study, in a pharmacy landscape, but you're in industry or wherever, just look at the toolkit and see how then can you, be useful to you. So as you reflect, these are some of the closing questions. You can take a screenshot for you. What will you do with what you now know? Yeah. As far as it depends on you, what changes can be accomplished by you improving your job design, skills, and responsibility. I don't know how many of you know here that you can actually go to your boss and change your job description. Yeah. How many of you here know that there's some changes you can make and you can accomplish by having an innovative and broader range of products and services? How are you introducing these things? How what are you reading to know even what's innovative? Are you even going for webinars or meeting with people in the nyumba kumi in that area, understanding what is working, what is not? Because the market is one, and amplify that. Some of you could be working for chain pharmacies, some of you are independents, and mostly I like talking to independently owned people because you can have the impact of chains by coming together as a nyumba kumi, and don't have shame in your nyumba kumi. You're working collaborating with farm techs, pharmacists, and specialists. Remember, we are saying we are act like the place you're going. Stop acting like the place where you are, because that's how you drive change. Yeah. For yourself. What infrastructure can you improve? What technology can you introduce, and what change can come out of that? What can you modify and improve processes, and what change can come out of that? How can you enhance your skill base? Yeah. Before I started teaching about coaching, as a change, I went for a 1-year course on coaching, how to be a coach. Yeah. And I invested in that so that I can be able to coach my team. Yeah. And so how can you increase, what can you do to increase your skill base? And I can see because of that change, it has an impact on my business, improving your customer service and altering your organizational structure. How many of you know that you can actually give feedback to your organization and say, let's remove that role or let's add this role into the organogram, and this is what it will do. But you have to go with that toolkit. Yeah, these toolkits that I've been sharing with you. This one here. Yeah. So go and unpack this. So have this, print it out, let it be, or even put it on your, somewhere on your folder. Like I said, it's on PDF. You're available through the Daktari online platform, and just use that to be able to drive change, so that whenever you are in your meetings, everyone is saying this meeting cannot start before Machogu comes in. Before, let me see who is here. I can see Barbara. It can't start before Lawrence, before Sang. Yeah. Yeah. So up to there, it's my turn to ask questions, to hear from you. You can put it on the chat there. I know there's some questions, 3 of them, so I'll address that. So we've done understanding yourself and the change responses. That's where we also discussed about the good pharmacy practice guidelines and how it affects you. We looked at the change landscape. We also looked at and the stakeholders and the external changes that affect us. We looked at the one agency, authority, and 3 bills: SHA, Social Health Authority, and the 3 acts it has. That is the primary health that governs level 2, 3, the emergency care and chronic care, 5, 6, and there is the SHIF, Social Health Insurance fund, those funds, yeah, that then deal with level 4, 5, 6, yeah. And that's why we as a sector need to embrace these following guidelines. Let me just go back. So as a sector, and maybe I'll leave it there so that we can now take questions. As a sector, we need to, please take a screenshot of this. Go look at the good pharmacy and practice guidelines, the schedules, yeah, costed pharmacy benefit packages, because all this is how we are going to move from a point of saying, oh, I can't afford to upgrade into a specialist or a PharmD because I don't have the money. Yes, we are going to be reimbursed for our services. And you, in your own one practice, you are going to be able to have enough resource to sustain yourself and practice there, because the patient needs you. It's just that we haven't had a structure to avail you there. So without further ado, I'll just go to your question. Good evening. Where can I get the previous CME? Daktari Online will address that. It's on the link at the Daktari Online platform. I know they haven't yet we'll be told about that. Yeah. Can we, pharmacy professional, be allowed to give intramuscular and IV medication and be covered by law because it's limiting us. Thanks, John. I don't know if any of you so I want you to go Google right now. Go Google this. Go Google think health, think pharmacy by FIP. Yeah, there's a whole guidelines there on how pharmacies, and that's where nationals guidelines are now moving towards that. So we have training in vaccination, where we are, and it's part of the services that you're going to be reimbursed under SHA and SHIF. Yeah, so you're going to be reimbursed for offering these services. Yeah, because there's some, what we're doing is the pharmacy is the first point of call for many, and that's why we have the primary care fund, we have the social health insurance fund, and the chronic care fund. So at all those levels, there'll be some services that the pharmacists will also be offering there, and you'll be covered by law. What I'd like to encourage you is, please, before you do that, go get your indemnity cover. Yeah, indemnity cover will require your professional certificate of good conduct from your professional body. You'll also require a regulator to license you. Yeah, a change is as good as a rest, but if it's done abruptly without consulting the affected parties, I really agree with that. And some of the changes that we have been trying to have in our sector have taken years. As far as I remember, I've been practicing for the last near 20 years, and even I've been a president of PSK for the last 7 years, and we've been talking about levels of practice. So there's been a lot of engagement, and that engagement, I can tell you, the delay has been because of course, mistrust, rightly so. Even me, I remember when I was graduating, and I'm hearing, okay, now I have to do a master's to do something. So kwani huo masters akona nini kuniliko, So, but as we are saying, as I've been practicing, I've seen that there's a really need of for us to have those levels, those schedules, and that's why it's really important for us to look at this element of the various guidelines that I have on this slide, so that we can be able to drive the change that we so desire in our sector. So those questions have been answered, except Amos, I think you'll answer for us the question on where the link, people can get the link, and you can just post the link on the chat so that colleagues can actually find it. So thank you. Any questions? I know we are coming to an end. Next week is the last. We are going to be talking about how to sustain the change and a culture of change. Yeah. But really, the Mwakenya is in that tool. Just familiarize yourself with this tool. We have internet. You can just go even look at it further. And I've really tried to unpack it for you. I've given you the case and how you can apply it and answer. So I want you, by the time we're meeting again, I want to hear stories of, I got promoted because of that. Or I even moved departments because of that, because I was able to articulate myself, in a certain way. Yeah.